this year. It's been a while. Sharuk and I have decided to come up with a new video for you as it's now 6 months into our internship, which basically means we're 6 months away from finishing.
Yeah.
So we decided to come up with this very short but informative Q&A. Hopefully you like it, you gain something from it. Let's get started.
We're both at the third hospital. There's a few of us. So the batch was divided in half and half. Half to first, half to third. So us two are from the half that went to the third hospital.
Yeah, basically what happened was the office gave us an option. If you don't know yet, then Jilin University has 3 official teaching hospitals. And towards the end of our last year, we were asked to, in a way, choose one or the other. And effectively, what Sharuk was just saying, we were divided into 2 different groups, and we decided to pick the third hospital. By the way, why did you do that?
It was a kind of a half and half, decision. How to say this? 2 major points came to make this decision. One point was that during my previous years, pre-internship years, so after first 5 years, during our classes we often have rotations depending on what subject we were studying, and I felt that now most of the time my group, again the batches were split into 3 groups. One group would go to the first hospital, one to the second, one to the third.
It was almost like depending on which department we were going to.
Exactly.
As well, right?
Yeah, and who can accommodate who. And my batch just happens to be the one that always ended up in the first hospital.
Mm-hmm.
There was, however, a few cases where we ended up in the third hospital. And my experiences from the much experience from first hospital compared to the minor experience from the third hospital, it showed a drastic difference. What the difference was, I just felt that first hospital was too busy for us to learn anything, and the doctors were just too busy. They knew we were coming. Sometimes they had plans, but even if they were organized for us, they just couldn't follow through.
Yeah.
So I felt that.
I mean, it's called the first hospital for a reason.
It's the flagship of.
Just some of you, in case again, if you don't know, the first hospital of Jilin University is meant to be, in a way, the most superior healthcare institution in this part of the country, for that matter. And what you said basically also played a major role in my decision, but in general I just find that place extremely busy, which means that the number of patients flowing through the doors is just enormous, which is fine to a certain extent. However, teaching is compromised. Our lecturers, in a way, or professors simply just don't have the time, and I felt like it wouldn't quite work. Whereas I'm not sure about you, but I find the third hospital, which is still major, it's still massive. I think it's 4,500 beds or something, so that's just nonsense. But in comparison to the first one, it's just not as busy. It seems to be a bit more organized. And some of our better teachers as well, it's a highly subjective matter, but for me at least, some of the better teachers are actually based there, so that's fine.
So, how's it been for you so far?
It's been an experience. I can't lie. I'm happy to have done 6 months already. It's been almost like a roller coaster. I think it depends on which department we're really talking about. Overall, however, this is what I would like to say. Prior to my internship, and the reason why I'm saying my internship, because I think it's important to highlight the fact that though we're doing this together, it's highly individual, right?
I don't know what's funny.
Future doctor, future surgeon. Anyway, the point what I'm just trying to say is that it's been a whole lot better than I thought based on what other people had told me. Now, I have various theories for why those people might not have liked it. That perhaps is for another video. But all I can say is that I'm happy in a way to have chosen the third hospital. I haven't regretted staying here, and I'm learning. And I think this is the most important thing. I am definitely learning, not only theoretical knowledge, but also practical as well. So we've had, especially, I don't know, like emergency, for example, although we are in different groups, we obviously had to do the same thing, but we got to do a whole lot of different kind of things. And I thought that was really cool. I don't think that in England, for example, or other European countries for that matter, with all the health and safety regulations you would have been allowed to do. In fact, I'm hearing, from friends who are abroad, mainly in Europe, they are restricted for a reason. But here, which could be both a good and positive and a negative thing, right?
It's how you make it.
I think so. What I'm trying to say is that, again, without repeating myself too much, I'm definitely learning, and for that reason, I'm happy. And one more thing, which is quite surprising, and this is not to show off, but Chinese language.
Yeah.
And I will come back to this at a later stage, but you get to practice, right? You have to.
Yeah.
People sort of like, respond to you, and sometimes it's a bit like, wow, they actually get what I'm trying to say, and it's I like it. What about you? What do you say?
For me, these past 6 months, it's been fantastic. It blew my expectations. I mean, in my previous vlog, again, I'll try not to repeat myself. You can watch that. I heard bad things. I just said bad things, period.
Bad man.
Yeah. And I also have various theories for that, which I did speak about them, so you can check that out. Anyway, so my past 6 months have been amazing. I started in Obs and Gyne. I'm sure you guys all seen how that went. And during my internship, I couldn't really make regular vlogs. It's just too busy. And even today, it's just one of those days where we have one free day, and we're trying to squeeze this video in.
I personally was on a night shift, which is not compulsory. So again, I think maybe in another video we can talk about this, but that's another thing. You got so much freedom in terms of what you might be able to do once you've done your regular duties and stuff. So emergency unit, for that matter, is always there. And so we're always welcome to sort of go there. And last night was one of the teachers' night shifts, and we were just free to go, and something that we've been doing, some of us have been doing for a while. So it's really cool, and we kind of like try to make a little deal. They also understand how this works. You can sort of exchange a day shift for a night shift, and so that's the reason why basically, daytime we should be at the hospital, but we're not.
For me, the department that I enjoyed the most, in the beginning, to start off my 6 months into this, was Obs and Gyne, and then after that the departments didn't really beat Obs and Gyne. Then I went to GI. GI was good. I'm more of a hands-on guy. I don't want to go to the hospital to learn theory. I've done that. I finished it, I don't want to be learning my ABCs again. So I want to go there to apply my knowledge and to use it in the physical aspects. So for GI, for example, that was the next one. I did endoscopy training. I did ultrasound training.
Yeah, I like GI as well.
It was amazing. The teachers were great. Funny guy, Dr. Jiang Bobo.
Yeah, he's a cool guy.
That guy, we have to get him on here one day. And then the next time I beat my GI, the department that really blew my expectation was emergency. I was able to do history taking, partake in diagnosis, and even treatment and examinations, you name it, the full-blown things. When you read a book and you go into those cases, there's a guy comes in the emergency department, you do all those examinations. I do that from head to toe, everything. And then the doctor will ask me, what do you think? What's the next call? How will you manage the patient? What will you treat? And I will do exactly what do this. Wound dressing changes, suturing up in emergency.
It was cool, kind of like we were sort of encouraged to do it, right? I remember first day we had a pep talk, and we were told that, look, you are interns, medical interns, not medical students anymore. You have to act like it, you have to do certain things. And I thought that even though it had been obvious, for me at least, the fact that you had someone highlighting it once more, I just thought, yeah, that's cool.
Yeah.
And actually talking about emergency, because I agree with Sharuk, because it wouldn't be too, in a way, like fair to compare the surgical departments, especially since we've just started this week. But
No.
we'll do another video on that at some stage, especially towards the end. But emergency, I actually wanted to talk about this. So I got this book. I'm not quite sure how much you can see, but it's basically an Oxford Handbook of Emergency Medicine. And I got this as a present, but you may be able to download it online or just buy. And the reason why I'm saying this, because I personally was carrying around this book every single time, and what Sharuk was saying, for example, is the same thing. There are just so many things going on at once, and at times I was kind of like overwhelmed.
Yeah, definitely.
And so it was kind of like nice to have something to very quickly flick through, just scan it through and then go again, have a better understanding. Or for example, when results started coming in, how to kind of like interpret them, right?
Yeah.
Like a lot of obviously like basic things, ECG, blood glucose level taking, all this kind of stuff, like applying handcuffs and just like monitoring the patient. But what do they really actually mean? And if they were to change, like what would that actually imply in general? And there's just so much, like, remember, this is an emergency unit, a lot of machines, a lot of people. You are just bombarded with various stimuli, right?
And I remember having, like, I could give 2 examples of this. For example, whenever a drunk guy came in, and we would check, we think, it should be hypoglycemic, but it comes out hyperglycemic, and then we learn how to interpret the result as in, it was hypoglycemic, that means it just happened now, or did it just happen later, or how we could basically use the results to see how long ago.
It's like things that in medical school you don't really
learn.
You don't really learn because it's not quite like the right place. But here there's actually like the number of drunk people. There's something about here with drunk dudes, and mainly actually dudes for that matter.
Yeah.
Anyway.
Sometimes the odd girl.
No disrespect, but sometimes the old girl comes in a bit boozed up. But the point what I'm just trying to say is that, again, emergency was really, really cool. And as I was mentioning previously, it's a department we can always go back. So for example, some of the more acute wards, after morning ward rounds and reading up on the cases, there weren't that many things to do. So we could just go back. I also like GI.
Yeah.
For example, I thought that was really cool.
A lot of consultations from many departments.
It was very different, of course. It's a very different setup, a very different way of going on about your business as a doctor, working with the nurses. It was kind of funny because some of the emergency patients ended up there. Yeah. So you could see them again.
And I remember this, like his group was in the emergency while I was in the GI, and Frankie, he called me like, "Hey, we're setting up an emergency guy."
And he was there.
And he was there.
And he was there. We swapped, and then he was there, and then the wife was like, "Wow, we know you." And you know what? It's just one of those kind of like interpersonal things, again, that I think medical school can't really prepare you for. It's kind of nice. Somebody actually recognizes you and they talk to you. And also on top of that, you could see that the person was actually getting better. Soon after he was actually discharged with a big smile on his face. I was like, maybe you could reduce the amount of booze next time or something. So the next 6 months is going to be all about surgery. For those of you who don't quite understand or familiar with the general structure of an internship, not just here but elsewhere as well, 2 major chunks will come from internal medicine and then surgery as well. And then around that in between, everything else as well. So
comprehensive.
Yeah. This has been our first week. I'm on hepatobiliary and pancreatic surgery. I'm not sure what you're doing.
I'm in orthopedic trauma surgery right now.
Could be cool. And so far, so good. It's been really cool to get into the OR on a regular basis. People actually are very willing. Surprisingly, and I think this is a cultural thing, everybody speaks English, at least or in this department. Definitely. Everyone, but they are shy. So this is something that, if you have watched our previous videos on Chongqing or the people of Chongqing, we might have already mentioned this. So this is something that you would have to get used to. But once you sort of establish a decent relationship, and this is something actually at emergency I forgot to sort of like mention, that once they get to know you, they sort of like understand that if something, you know, happens, they can actually talk to you, you can respond, they let you, and they are very, very willing. As a foreign person, you seem to be some sort of a unicorn in there anyway, so like they like having you around, but you have to make the first step. So it's been good. I enjoy it. You know, I personally have managed to scrub in. As far as assisting goes, I was able to walk around with the suturing, so at the very end of the procedure. It's an area anyway I'm interested in. I like the physiology of these conditions anyway, and you just have time to really then see what's going on, talk to these surgeons. They have enough time to sort of explain everything, and also everybody else, not only like the surgeons, but there are so many trainees there, for example, some other interns as well, or just like, you know, specialist nurses. The entire environment is completely different, and I personally really enjoy it. I don't know how about you.
It's been amazing. It's been a blast of a start for me for the next 6 months now with the surgery. I'm in the orthopedics, and orthopedics should have 3 sections: trauma, spine surgery, or joint. So I started with the trauma because I'm all about the emergency and the surgery and suddenly coming in, you know, just cut, suture. Anyway, but it's been fantastic. I mean, I now personally me, we'll talk about in a moment about advice, but just a quick thing, I make a portfolio of all departments I go to. You've seen it,
Yeah.
and that really helps me getting the new department like orthopedics to get to know me, what I have done in my past, so they can have more of a trust with me when I'm doing the surgeries. So I don't just observe, I also scrub in. And so I do the ward rounds in the morning. Suddenly a new patient comes in, maybe someone needs a wound dressing or debridement or something, whatnot. So much to do.
Go for the suit to do this kind of thing,
Yeah.
right? Yeah,
And
they
then,
let you do it.
After that, I was scrubbing, for example, and they will say, okay, I want you to suture this. Can you suture this? And they will see on my first day, they saw me, I could suture pretty well, like as it's shown on my portfolio. Then they sort of got to know me, the interpersonal relationship, the trust was built. I spent a lot of time with the trainees, with the master students, more than the attendings, because the attendings are very busy.
Yeah.
And the master students can get you in left and right, you know, certain things.
You can actually go with them, and they're perfectly fine with just taking you around. So that's almost like a free pass into the
and
hours and
it's
stuff. So
it's fantastic.
it's
I highly encourage that. And just to finish off this, like 2 days ago from making this video, they let me do the whole surgery. Like, I was blown away that they let me do it. All they did was, in orthopedic, was open up the knee to check everything is in place, and they said, okay, complete the surgery, remove the plates, everything. I'm not going to go into details, but you'll see maybe in my future internship video of what my experience was like. So you can do a lot here. It's what you make of it every time.
obviously we are finishing up in 6 months, and well, I think it's also time in a way to sort of talk about what might be happening after. You see, here at Jilin University, obviously there's a relatively diverse pool of students, most of whom will probably be going home. I know of people who are planning on taking the USMLE and they're planning on going to America. I'm certainly not one of them. What's your take on this? What's your plan?
6 months left. It's both exciting and it's both dreadful as well. Dreadful as in not that, oh, we're gonna have responsibilities or patients, we go back. No, dreading as that the 6 months we've got to get all our documents sorted. We've got to get our applications or the online accounts made. For me, I'm gonna go to the UK. I was gonna do the USMLE, but for me it was made no point. My family lives in the UK. I want to go back to the UK. End of story. Period. Just like that.
It's also not a recognized or accepted.
Yeah, the USMLE is not accepted.
I think this is a very
UK.
important thing, guys. Not to try to brag about this, because there was a time when I wasn't aware, but you should make sure that you know where you're going. Because certain examinations may not be recognized, and so you might be there to, you prepare, you pass, you obviously pay up all these fees, and then it turns out that you cannot actually what I'm trying to say is that for one reason or another, there seems to be a general confusion amongst medical students here. Not many really are aware of how foreign admissions work, how foreign examinations work, where you can go.
They think of it this way, the way I've seen it from as a sixth year, as a junior doctor now, what I'm seeing from juniors is that apparently USMLE is the top exam. So automatically all of the countries will accept it. Not true. Oh, the Canadian exam is harder, or I've heard the Pakistani medical exam is even tougher than the USMLE, so it should be accepted in certain countries. No, these exams, license exams, the way they ask you the questions are according to their country statistics, their country's way of doing things. The PLAB only accepted in the UK. Is that true? No, the PLAB can be accepted in the UK and some Arab countries, for example. The USMLE can be accepted in the USA, but not in the UK. It's different.
Basically,
Make sure
you
know, which country, what the requirements are for their license. So my plan is to get the GMC license, which is the General Medical Council of the United Kingdom, to get a license, get registered on there within the next 6 months after I graduate, and then hopefully I will go into a program and get myself into surgery. Our internship is regarded as FY1, Foundation Year 1. And when I go back to the UK this year, inshallah, it will be Foundation Year 2. Once that finishes, then the following year we'll go into specialty training, which will be, for me, surgery.
So most likely the next 20 years, you know. Well, wait a second, what's for the next 6 months?
Next 6 months.
Years. Okay, so
next 6 months, this is
now you know what's good. Fair enough. I'm also planning on going back to the UK. And just for those of you who may not be familiar with what FY1 means, it's basically Foundation Year 1, which effectively is a sort of a year 1 for freshly graduated doctors. That's basically the very first year when they are taking up on medical duties, and they are getting paid for it, and it counts towards their secondary training. So the internship that's taking place here is recognized by the GMC, so the General Medical Council, but it may not be recognized by other medical councils. So again, I would highly recommend that you just check. And this is something that you can do at any stage of your studies so that you can plan ahead. But yeah, basically the next 6 months, finishing off, getting ready for graduation, taking all the documents. You have to attest it, notarize it, get it stamped here, there, and then going back to Europe. And
that's really important as well, how you're going to attest your degree, your medical degree, the MBBS degree. For us, you and me, we're going back to the UK, we won't be needing to go to specific places to be attested, like Beijing.
I think the point here is that, again, it's highly specific. And at this stage, when you get to this stage, or if you are already at this stage, you should certainly be looking into it, because these are not that many in numbers. However, they can take ages to really find out about, and then that's just like time and so on and so on. But anyway, well, good luck with the last 6 months, and then I'm sure we will come up with a comprehensive overview at the very end of it.
Definitely.
Hopefully with the others as well.
Yes.
In which we will probably just discuss this again. So, just to finish this video, any advice for current interns or future interns?
Sure, there's many.
Let's stick with like maybe top 3
Yeah,
or
alright.
maximum.
My top 3 will be, number 1, do not expect the hospital to spoon feed you. Be organized yourself, know what you're gonna learn today. Like, I'm gonna go today, I'm gonna do this. I'm gonna go today, I'm gonna do a central venous. I'm gonna go today, I'm gonna do an ABG. Have your goals set out, tell them what your goals are, so they can help you achieve them. My second point would be make a portfolio. I think that's, for me, it's been the biggest, like a massive help every time I go to a new department, because it builds up anyway. And then slowly get to know you more in a shorter time by seeing like your experience. And number 3, I say be independent.
Mm.
Highly independent. Like, do not expect.
Don't rely on others.
Don't rely on others. Do not rely on others. Be independent, but be ready to like fight for it. You know, fight for certain things. There'll be many times that will push you off or show you off based on their experience of previous students that were not so diligent, not so effort putting. You know, so go in there for your own sake. Go in there with an intention on that day. That's every day. And go every day. Don't go one day, not 2 weeks. And of course, no one's going to take you serious. Go in there thinking that you're going to make a difference to someone's life. And you're going to come home having achieved something. It could even be an injection. It could be a history taking. It could be anything. But achieve something.
Sense of doing something, right?
Yeah.
Okay. Well, as for me, I would, without repeating some of the points that Sharik has just highlighted, I would say do it for yourself. And the reason why I'm saying this is because you will have your classmates around, but most of the times you may just find yourself to be the only one around here. And it can be disheartening in a way. But if you understand that everyone here is for him or herself, and you can establish a good rapport with other people, then there is absolutely no reason why on a day, for example, when you're alone, you couldn't just turn that into your own advantage. So that's one. Don't be sort of like, don't rely on your classmates. Not because they are not cool people, but I mean, at the end of the day, they won't be there for you, you know, holding your hands. And so it's something that you have to do by yourself anyway. So might as well just start now. Another thing is Chinese. And this is a thing that I wish we had. I personally like learning Chinese. And I like interacting with people. I'm not saying that I speak absolutely amazingly. However, it has been such an asset. The fact that you can communicate with the locals, the fact that you can actually sort of like get them understand what you're trying to say without forcing them to speak much English. Because despite the fact that most of them really do, they won't really tell you unless they have to speak English. They just won't do that. However, if you start speaking Chinese and then they hear you sort of being able to communicate, then it's more likely that they warm up to you.
They start respecting you as well.
Yeah, that's also another thing. But in general, the most important thing for me is just, you know, interpersonal relationships. And as I said, it has been such an asset. And when it comes to discussing things with patients and or relatives, it's imperative that if you don't speak to them, it's just a bit stone cold and it's not part of the full experience. So if you haven't already started, then I would highly recommend that you brush up on your Chinese.
That is part of your internship. A major part is like put the knowledge aside. Your communication skills as a doctor, your bedside manners are a massive thing.
Yeah,
massive thing.
And you can only get these by really, you know, sort of like practicing it, right? And be with different people and be subjected to different situations and having to sort of like, you know, come out at the other end. So my third, in a way, final advice would be, do not listen to other people. And I'm saying this in a way, take this with a pinch of salt because I'm another person as well. So effectively, I'm saying something, but do not listen to other people having not made sure for yourself then that what they are actually saying is true, or if it's actually in a way working out the same way for you. And the reason why I'm saying it is because it's super easy to get complacent here, comfortable, and just go with the flow. Just like not go in, for example, for various reasons. And what happens is that with time, this becomes a habit. And after that, it's just extremely difficult to get the hang of it when you really don't know where to go. You don't know those people, they don't know you. Nobody really cares because that's for that reason, like, what are you doing here? Who are you supposed to be with? Because believe me or not, everybody sort of, or every group should have at least a clinical supervisor or something. So what tends to happen is that there's a lot of negative feedback. Now listen, this is important. As Sharuk was mentioning at the beginning, and I haven't really done it much so, but there are departments which are just less enjoyable. That's why I said that at times I personally just go to the emergency unit again. There are people who just don't seem to be, they're interested. Fair enough. So it's definitely not all gloomy. All I'm saying is that it's a whole lot better than what I was, in a way, preparing for, because what I had been told before was simply just so negative. So do not listen to people. I am not here to guarantee that you will have an amazing time, but I can tell you this: if you do at least open the door for gaining something and you are willing to put in the effort, I really believe that this could be a good experience for anyone who chooses to stay here and stuff.
I've always said this. I've stressed this point, what Alex has said in my previous vlogs. It's 100% true. Don't listen to other seniors who say that's been negative, it's bad, no one cares.
Also, I often feel like that most of these people actually, and no offense again, this is not to sort of single anybody out or diss anybody, but I often just wonder, like, have you really tried? Have you really been in? Have you really gone? The truth is that, yeah, I've done this, but it's not really the case. And I've
often found that they often cannot speak a word of Chinese.
Yeah,
and it comes back to that point with the Chinese, is that if you cannot understand Chinese, the doctor cannot ask you, like for example, Shahrukh, can you go and take his history? Well, I'm doing this, let me know what's wrong with him. You can't do that because the patient cannot talk English.
Well, it's not even just there, you don't even understand what they want to do. Like as I said, some people, a lot of people can speak, but great majority will not. And it's like this. So I think most of these negative reviews actually arise from the fact that there's this basic lack of communication between different parties, and then from then on it's just like a domino effect, everything falls. So yeah, well, this is basically it. 6 months gone, 6 months to go. I hope that you guys have managed to gain something. It was just a general Q&A, even though it's not dragging on forever. But yeah, thank you so much for watching. Thanks for doing the video.
No problem.
Good luck for the rest, and we will see you guys in our next video.
Yeah.
Bye.